Hi, my name is Dr. Cary Gans, and I'll be the narrator for this 6-part series called 911 Dental Online, your online resource for dental emergencies. Now, during this video, we will discuss actually 6 separate topics, so we'll divide it up into 6 short videos for you, so it makes it easier to view them. Now, what's very important is for you to understand the following disclaimer. This presentation is intended to be a supplement to any additional information you can find online or in reality offline. It is also suggested that you call your own dentist prior to taking any action. These various videos are really intended to help you in case you can't get your dentist on the phone. Now, the information contained within this presentation is based upon generalities and therefore cannot be used for any specific condition for any particular individual. Now, since it's impossible to fully diagnose any dental condition without a thorough clinical exam and x-rays, this information is to be used only as a guide. Now, it's very important, so pay attention. Should you have any pain, swelling, or bleeding, please be sure to call your dentist immediately. Those are what we in dentistry call true dental emergencies. Now, if you are in need of a dentist, you don't have one, you can always call your local dental society. You can also call your local hospitals, check your yellow pages, and if necessary, go online to our website at 911dentalonline.com to the link section. There we've listed some dentists that may be able to help you depending upon where you live. This video is divided into 6 sections. You can see the 6 sections listed above. Problems with crowns, bridges, and partial dentures, denture problems, root canal issues, problems with dental implants, oral surgery problems, and just some general dental problems that tend to pop up every once in a while. We've intentionally broken this up into 6 shorter videos to make it a lot easier for you to review. In our crown and bridge section, which is the purpose of this brief video, we have 4 questions that we find, we as dentists find we have to answer most often. My temporary or transitional crown has come off, what do I do? My removable partial denture is so tight I can hardly remove it, what can I do? I've swallowed my crown. What do I need to do? Is this truly an emergency? And finally, I just left the office after having a new crown placed. It's gorgeous, but when I bite on it, it hurts. Should I leave it alone and wait or call the dentist? Well, let's answer your first question first. My temporary transitional crown has come off. What do I do? Now, if your temporary crown has come off, we suggest you do the following. Now, a temporary crown is typically placed on your tooth after a tooth has been prepared for a crown. While you're waiting for that crown to be fabricated at the laboratory, your dentist will place some kind of temporary crown on for you. It's very important that this crown be replaced should it come off. So first, if you cannot get your dentist to do it, if you're some remote place or the dentist is not available and you can't find somebody else, first gently clean out the remainder of the cement that may be in the crown. You can use a toothpick or some small type tool. Secondly, take a small gauze pad and try to clean your tooth as much as you can. Don't leave residue on there because the temporary crown may not reseat. Now then, you can either use a product called Dentemp, which is available at most drugstores, or you can even put Vaseline in the crown. Sometimes this will help as well. Now, some patients prefer to use Fixodent, which is something that's used to hold dentures in place, but it tends to work pretty well for temporary crowns as well. Now, what's really important is before you actually cement it, try it on yourself, just so you get a feel for which way it goes and how easy it is to put on and off. Because what you don't want to do is cement it and then to find out you cemented it incorrectly. If there's any doubt, leave it alone and get your dentist on the phone. But please, do not lose the crown. Your dentist will just have to remake it, and which adds time to the entire process. The second question relates to partial dentures. Because sometimes partial dentures, when they're new in particular, are so tight you can't get them on and off. So it is not unusual for that to happen. Very often the retentive clasp, or the devices that are used to hold the partial denture in your mouth, are tight when they start, but they do loosen naturally over time. Under no circumstances should you force this removal. This may cause damage to either your natural or restored tooth or the partial denture. If you're in pain, you should call your dentist. If not, you can try again later on to see if the partial denture comes loose on its own. But once again, I would not suggest that you force it. Now make sure that you are removing it as instructed by your dentist. Partial dentures are all different and all unique, and it's important that you follow the directions given to you by your dentist. If you're wearing a pulse denture that has some type of precision attachment, little devices that are used to hold the pulse denture into your mouth, where they attach to crowns or caps on your teeth, once you do get this out, if you're afraid to put it back in, you can always put a little small amount of Vaseline on the attachment itself. This might help in the removal at some time in the future. Question number 3. I've swallowed my crown. What do I do? Is this considered to be an emergency? Now, the answer to this question has a couple of parts. First, if you've swallowed anything, I don't care what it is, it may get caught somewhere within the gastrointestinal or respiratory tract. If so, this may cause a medical problem. You should consult your physician and get advice. Next, after speaking with your physician, it really depends upon whether the crown is a permanent one or just a transitional one. If permanent, you really might want to find it. Now, I'll leave it to your imagination as to how you might go about doing that. If it's transitional, meaning it's plastic, well, maybe just have another one made. It's a lot more simple and not quite as messy. Now, the whole point to be made in the answer to this question is really a medical one. So please consult your physician as to whether or not they believe some kind of medical intervention is required. Of course, give your dentist a call as soon as you can. And finally, in this section, I just left the office after having a new crown cap placed, but when I bite on it, it hurts. Should I leave it alone and wait or call it ends? Well, normally when a new crown or even a temporary crown is placed, a local anesthetic is used. This can alter your ability sometimes to be sure that your bite is accurate before you leave the dental office. So sometimes bites can be a little, what we call high, where you hit that tooth before you hit the other ones, which can cause some discomfort once the anesthesia wears off. Because when you're numbed, sometimes you bite slightly differently. If that's true, your tooth can become sensitive, more sensitive than normal, to even pressure or even temperature changes. It's important that you call your dentist right away and come into their office as soon as you can to have the bite adjusted. It's a real simple solution and can be done in a matter of minutes. However, if left untreated, that poor tooth will become increasingly more uncomfortable with time, and the pain will become increasingly more difficult to bear. So it's really suggested that if the bite's a little high on a temporary crown or a final crown, that you give your dentist a call so that they can adjust it. Now, that's the end of this series, Part 1, on crowns and bridges. We'll see you soon for Part 2. We hope this answered all your questions, and that if the time comes and you need the answers, we're here for you.